everybody. Thank you for joining our Alumni in Medicine panel. We have two great alums who are on with us today, and hopefully one more will be joining. But I would love to just start us off. Will you both introduce yourselves, share your DCDS class year, where you went to college, medical school, where you currently work, and just a bit about what your job entails?
Sure, I can start. I'm Arita Mallory. I went to Country Day. I graduated in 2009. And I went to undergrad at University of Michigan. And then I actually went to dental school. So I'm a dental perspective. I went to dental school in Wisconsin at Marquette University.
And my name is Hirsch Kavishvar. I'm a class of 2004 alumni. And I went to Michigan State afterwards, stayed on there for medical school. And currently I practice in Los Angeles. I'm a specialist in neurology and interventional pain management and spine. Involves a lot of, clinic work and procedural work, but I also have been recently in the past couple of years, been kind of delving into like telemedicine and digital health.
Very cool. Okay, so let's kind of take it back to when you guys were in college and or medical school. So do you feel that there was anything looking back that you did that were keys to getting you to where you are today? So outside of obviously, the routine classes and things like that, were there things that you did that you feel like maybe gave you a leg up or just made you more knowledgeable about the field that you were getting into? So, and along with that, what recommendations would you have for students to do outside of class to sort of set them up for success in that way?
Sure. One thing that I did that I think was a memorable experience outside of the traditional taking your coursework, of course, was the year that I applied to dental school. I did an AmeriCorps program. So I worked in Detroit for a year with elementary school kids and basically helped with tutoring after school programs. We kind of had like a science-based one. I think really just kind of doing something a little bit outside of your traditional preparation kind of can give you a little bit of real world perspective. And I found that was something that was unique to talk about when interviewing and things like that as well.
That's cool, Arita. What was the program that you did?
The program I did was City Year.
Cool. Okay. Love that.
Yeah. I think I kind of feel similarly in the sense that getting some real world experience is important aside from just doing the classes. I think, like I worked at in ER through the senior project. I don't know if Country Day still does that, but there was a senior project.
Cool. Yeah. Okay.
Yeah. There, I worked in the pediatric ER at DMC Children's Hospital. And then just kind of, I think the main thing is to really, if you can just get exposed to like the day to day as much as you can and sort of the routine. Because when you end up doing your job, there's a lot of cool, glamorous pathology and things you're going to see. But at the end of the day, you're going to be seeing like very routine day in and day out work. So I think it's important to expose yourself to that and see if it's something that you want to spend your time doing.
That's great, Hirsch. Can you tell us a little bit about how you got your senior project? Because so many students want senior projects in medicine. And I think it would be really helpful if you could just share with us about how you went about that, what that experience was like, and maybe as a high schooler, what someone should be expecting.
Yeah, I think luckily a lot of my classmates, had parents that were physicians. So it was just more like reaching out to their parents and seeing if they'd be willing to host us. And I think if you talk to most, even me now, if some high school student was like, hey, I'd love to shadow you, it'd be no problem. I'd love to do that. So I think especially in healthcare, this is how we're kind of trained is we always have med students around us, residents around us. And so it's really not too much to ask for a high school student, even if the it's like a department head or someone really high up. In fact, I think being a high school student, you almost have a better opportunity to expose yourself to really higher up people, because people are always looking to sort of inspire high school students.
Okay, awesome. Arena, do you feel the same way about that? Do you have any additional thoughts?
Yeah, I mean, it's sort of early in your career, but it's kind of like early networking, really.
Mhm.
So if you have friends and family or who are in the field that you're interested in, um, that's helpful to kind of get your leg in to get exposure. My senior project was completely random, unrelated to healthcare at all.
Okay.
I worked with one of the local magazine publications.
Mhm.
So I guess that's maybe perhaps another perspective is you're still young and have a lot to decide. And it's kind of one of those things where you can always explore other options. And maybe senior project even is a good time for that because it's
Mhm.
kind of early, it's kind of low stakes, if you will. You'll still learn something from it. And then you can maybe have a different outlook and purpose on if that's something that you want to pursue or not. So you can learn something from even if it's not healthcare per
Yeah.
se as well.
Exactly. So just to kind of stick with this topic for a second, did both of you know when you were in high school, Hirsch, it sounds like you did, but did both of you know that you wanted to be in the medical field when you were in high school? Or was this something, Rita, for you that developed, later when you were at Michigan?
Yeah, I sort of was interested in going into healthcare in some fashion, but I also was open and wasn't 100% set on anything at that stage of my life. So for senior project, I think I just was curious to do something different.
Okay. Yep.
Mm-hmm.
Yeah, I mean, I think I wanted to explore it early on. I went through some phases in college where I was thinking about business major, et cetera. But, not in retrospect, a lot of it looking back was it came down to peer group because a lot of people around me were sort of interested in it.
Mhm.
And so I think peer group has a lot of effect on us more than we realize. And so I was surrounded by science majors. So I sort of just, I just sort of just gravitated towards that way. I mean, I don't know if it would have been different if I was surrounding myself around different people,
Mhm.
but yeah, I think I agree. I think it's so early. It's so important to keep an open mind. And that is a good perspective to maybe explore other things that might be on the periphery that you're not quite sure about.
Okay. Awesome. Okay. So let's talk about medical school, guys. So what should students expect from medical school? I think it's a little bit easier for people to visualize, okay, law school, like this is what I'm doing. But I think medical school is just like an entirely different thing, or dental school. So what should students expect from the years in medical school or dental school, Arita? And how did you choose the right school for you and your interests in what you wanted to practice?
So dental is a little bit different. The first 2 years are very similar to a medical school curriculum. Some programs they take them alongside their medical schools. It just kind of depends. So
Mhm.
that's more didactic, science-based stuff. So you can expect to be studying a lot and having a lot of assessments.
Okay.
For dental, you have the hands-on aspect, which begins your first semester, but it's on a mannequin. So for dental school, you have your science courses, but you'll also have projects and hands-on things that'll be due, developing hand skills, learning dental anatomy as well, stuff like that.
Mhm.
So there's kind of an artistic side to that. If you're interested in dentistry, a lot of times there's folks will kind of take on some sort of craft or hobby that involves utilizing your hands and developing kind of more fine motor skills as well.
Okay.
And a lot of schools will even ask you about that on applications. And then as
What
far
did you
as,
do?
so actually in college, again, I kind of did a lot of different random things. I did makeup for one of the publications at U of M, and also some local businesses for like ad campaigns and stuff. So I talked about doing makeup.
I love that. Okay, I'm sorry, I interrupted you. Keep going with what you were saying.
You said deciding on schools.
Yeah.
So the process for medical and dental, usually you'll end up getting invited for interviews, which is traditionally in person. You'll get to evaluate the school, see the school, kind of get a feel for the students and the faculty. So I kind of went off of the program that I felt like I enjoyed the atmosphere the most.
Mhm.
But I also think realistically looking at finances is huge too, because these are all fields where you'll end up with a significant amount of student loan debt.
Yeah.
So any sort of scholarships or things that are offered to you financially, I think should be probably viewed maybe number one.
Yes. Okay. Hirsch, what about you?
Yeah. So, medical school first 2 years are just pure didactic work. You're in the library all day, listening to lectures, and someone described it like drinking out of a fire hydrant, which I think is accurate, because you're just, if you can think about like your work, I don't want to make it sound grim, but like if you can think about your like busiest finals week ever in high school or like in college, it's like that constantly.
That sounds grim.
Yeah. So it could be a little bit of a mental challenge, because a lot of your colleagues that are like in business or whatever, you know, they might be in cool cities having fun, and you're just in the library on weekends, just grinding. But then it gets better after you finish that, and then you have your more clinical work where you're rotating in the second 2 years at different specialties, and kind of getting a taste of which specialty you want to apply for in residency in medicine, which is another like minimum 3 years. And in some regards, that's really where your training comes from. As far as how I chose the school, I couldn't agree anymore. I think financially, that has to be a big consideration. I think if you have a sort of a research interest, or if you have some sort of mentor or something at some other school, that could be a good consideration, or the atmosphere, like she was saying. But for me, it was just straight up, local. I didn't have to move. I think I stayed at the same. I like moved over a block over from where I was in undergrad, and it's a very easy transition to stay at Michigan State. So that was ultimately my decision-making process.
Can I ask you guys a question about the transition from college to medical school? Because in our law panel last week, our panelists were all saying, that's a really difficult transition, because you are not in college, but you are obviously in a university setting. So did you find this transition from more of like the social undergrad element to medical school to be a challenge?
I mean, I think one thing I'll say is, even looking at, your time in high school, I personally felt the first at least year in some ways of undergrad, I felt very prepared with my time management skills from having gone to Country Day. So I think really looking at honing in on really making sure your time management skills are intact, because at the end of the day, kind of like Hirsch was saying, there's just so much material that it ends up becoming a prioritizing what you need to study the most for kind of situation. Like if something's worth more, well, maybe you're going to spend more time on that. Or if your grade is better in this course versus the other, well, perhaps you're going to, kind of have to do some evaluation. But I do think you'll learn those time management is the hugest part of that. It's just, you'll have to alter your actual schedule to accommodate the rigor.
Yeah.
Right. Yeah, I agree. I mean, especially now that I'm working and I went through residency, which is arguably even busier. In retrospect, it's actually not bad. Like you just have to sit and study. And then if you just do that and you properly or stay disciplined, then you'll still have time for like socializing and things like that. I mean, is it going to be like undergrad? No. But I think if you treat it like a job, like, 8 hours a day, I think you should be good.
Okay. That's a really good transition. So talk to us about how each of you got the jobs that you currently are in. Again, I think that this is something that students need to understand if they're going into healthcare. It's oftentimes you take many different steps to get to your job, different than being a lawyer or in business or something like that. So if you could both explain to us how you did that, that would be great.
Sure. Actually, to touch on specifics. So for dentistry, undergrad, obviously, is 4 years. Dental school itself is 4 years. And then I'm a general dentist, which in many states you don't need a residency for. You can actually start practicing right away. So I did not do a residency. But folks that do residency, it's a little bit of a different path. Those vary in length, and it depends on what you're doing. And what your job prospects would look like thereafter. For me as a general dentist, my first position and a lot of my colleagues' first positions these days, unless you have family or a mentor that is going to work with you, a lot of folks are working, I'd say, in either lower cost healthcare clinics or in corporate settings. That's kind of what's popular, I'd say, for first jobs. So my first job was with a corporate dental group.
Okay.
So I learned a lot, but the pace of a corporate type approach to medicine for me was not something I wanted to do long term. So I worked there for 1 year.
Okay.
Thereafter, I've worked at a couple of different private practices, and I'm buying into an existing practice at this stage of my life.
Okay, cool. And I want to hear a little bit more about that in a second. Can you, Arita, tell us what is a corporate dental practice? Is that just like a very, very large practice with different locations?
Precisely. So basically, you'll have basically like a business that has a model that'll exist in a variety of different states, for example.
Okay.
So one that's popular is like Aspen Dental, if you've ever seen one of those. That's an example of a corporate office. Basically, the folks that own it have a business background. So the way that things are approached are a little bit more with a corporate end goal in mind, which can be great learning experience for folks. But again, it's kind of like very, very numbers focused, maybe a little bit more so than what you're used to.
I see. Okay. That makes sense. Okay, Hirsch. Go ahead.
So yeah, just to lay out the path. So 4 years undergrad, 4 years med school, 1 year of internship. Then I did 3 years of general neurology residency at Henry Ford Hospital downtown.
Okay.
After that, I did a anesthesia pain fellowship at Wayne State DMC. Then after that was 1 year. Then after that, I came out to Los Angeles and I trained in a field called sports neurology at this orthopedic clinic here called Curl and Job. That was for another year. That was, to be honest with you, that was a little bit more optional. I just got really good opportunity for mentorship. Okay. And so then after that, I joined a private practice, very busy private practice for 2 years. Decided, that kind of style of medicine, at that particular place wasn't for me. So I decided to start my own clinic. And so I have several different things going on. And this is, I'll touch on this maybe later, or maybe I can just touch on it now, but I didn't realize this about medicine, but with your medical degree, and I'm sure a dental degree or any degree, really, you can utilize your degree non-clinically as well. So I do a lot of legal consulting. So expert witness, independent medical exam for the state of California and other involved players and any kind of insurance kind of consultation. And record review and things like that. So I kind of have a hybrid sort of, I have my clinic, I have a digital telemedicine clinic, and then I do a ton of med legal work. And it can be, it can be very rewarding, both, professionally and financially. And I think that's a field, or that's an aspect to medicine, which I never really thought about going into it, because you always think about seeing patients and treating patients, but there's a lot of ways you can utilize your degree, even if it's like working with startups and businesses, et cetera.
Wow. That is so interesting. Yeah. That leads me to asking, can we talk about like, what is a day to day for you guys? Like when you wake up, like from the time you go to bed, like what does your day look like?
Sure. So with my current position, I have a more kind of set schedule. So usually I'm working from 8 to 4. And I basically I have my own column or schedule of patients. Okay. Procedures that dentists do include things like fillings, crowns, removable partials or dentures, making adjustments, things like that. Okay. So that's like your kind of bread and butter main stuff. You're doing extractions, stuff like that. And then usually I have 2 full-time hygienists that I work with. So they have their own schedules and they see maybe let's say about 8 patients a day. Usually they'll need a dental exam. So that's when the patient will get their soft tissue and hard tissue exam, oral cancer screening, see if they need any treatment, etc. So I guess in a day at this office, I probably do, let's say maybe maybe closer to like 16 exams a day. And then I have my own schedule, which really just depends on the procedure. And then I leave and if I'm good, I work out. If I'm not, I don't. And then if I'm good, I cook. If I'm not, I don't. And then that's my day.
Love it. Are you ever responsible for, are you like ever on call for like a dental emergency or anything like that to go into the office?
Sure. Good question. It depends on the setting by which you work. So the first position that I worked at, I would take a lot of emergency calls, which usually just becomes sort of screening what they need. For dental, if you have a true dental emergency, usually they need to go to the ER. So that's, I'm not going to necessarily meet somebody at a practice.
Okay.
It's more so evaluating what the patient's going through. Sometimes if it's something like they need an antibiotic based on what they've said, or if it's post-op discomfort or pain, kind of assessing what the situation is. But usually for dentistry, which is another good thing to chat about, is work-life balance for dentistry in particular is traditionally quite good.
Mm-hmm. Okay. So what are some of the most challenging things, Arita, that you see every day in your office or, weekly or something like that?
Okay. Sure. I'd say not as much in my current setting, but it's really patient population based. The first job I had lots of folks who never really went to the dentist or did not go regularly. So I'd say what would be challenging is kind of coordinating with basically extensive medical histories, lots of unchecked active issues, managing pain. That's huge. So for dentistry, there's a lot of situations where people are in a lot of pain. People don't necessarily want to see you. So managing that, developing patient rapport, all of that, I'd say is probably the most challenging.
Okay. Thank you. Hirsch?
So, I'm not necessarily the best person to ask for the typical day because I don't have a typical kind of schedule,
okay.
But from a typical standpoint, you either have inpatient doctors or outpatient doctors. Inpatient meaning in the hospital. This typically involves rounding, taking call. There's oftentimes a hybrid where people have a clinic and then they round, in the hospital, see the patients in the hospital. And then oftentimes the idea is those patients in the hospital then become patients in the outpatient setting. And so that's when people think of what a physician's job looks like, that's usually what it entails. And it can be quite busy and involve weekends and things like that. For me personally, I sort of by design didn't want that. And so my days aren't very typical. The only typical days I have are really Tuesdays and Thursdays where that's like my true pure clinic days. And then in the morning, in the morning of those days, I'm in the OR because I'm doing spine procedures, and then in the afternoons clinic. But then the rest of the time, it involves a lot of like the consulting work that I was talking about, and a lot of travel, going up to the Bay Area and things like that. And so, I like to do a little bit of everything. And I suppose, not just with the Country Day audience, but I guess just in my other physician colleagues, I really try to emphasize there's a lot of other things you can do if you want to, with your degree, if you ever feel like stuck, or if you want to have a dynamic career, that's totally possible.
I love that. Can you tell us a little bit about what you see in your clinic or in the OR?
Yeah. So basically pain head to toe. Anywhere you're having pain, if it, whether it's medication management in the clinic, sometimes it does involve opioids, which brings me to one of the challenges is we have an opioid epidemic going on. And because of that, there's a lot of scrutiny on physicians. So one thing I do want to also emphasize is, and is often not talked about, is that there's one of the challenges of being in healthcare is we take on a lot of liability and risk. And so you do get compensated, but like you have to understand that there's a large element of risk involved, and you always have to be very aware of that. And so it can be stressful. You're in the customer service business, so people have high expectations, and sometimes you have to learn how to manage that. And at least in medicine, insurance reimbursement keeps getting cut and cut and cut. And so then you're ending, you talk to doctors 20 years ago, they're seeing double the amount of patients they're now seeing, and just to make the same ends meet, and the quality of care because of that suffers. Ultimately the patient suffers. And so it can kind of feel like factory work almost. And that's why actually I left my first job, because I was like, this is not really what I wanted to do.
Yeah. Wow. Okay. So let's wrap this up with both of you. And I so appreciate you being on. Tell us what you enjoy most about your job and what is the most fulfilling for you.
Sure. I think for me, dentistry in particular is neat because a lot of people put a lot of value on their smile. And there's a lot of very kind of satisfying just before and afters and how much your smile can impact someone's self-esteem. So I think kind of just working with someone and having a patient be happy and satisfied is very rewarding. Likewise, when folks come in and they're in a lot of pain, them leaving, they can leave the exact same day and they will feel better. There's a lot of instant gratification with dentistry.
Wow, love that. That's really
I think the same thing. Really helping the patients out, and for even if you have like 10 challenging patients, even if one is really appreciative and happy, it makes it all worth it.
Mm-hmm.
And then I like using my hands, so I like the procedures, and I find that very just satisfying there. So there's a lot of challenges, but I think the rewards are certainly outweigh them.
Well, you guys are both awesome. Thank you so much for doing this. It was great. I learned so much. I know our students will too. If students are interested, is it okay if they reach out to you?
Absolutely. Sure.
Awesome.
Absolutely, yeah.
Thanks, guys. Really appreciate it.